Hi everyone, Dr. Karan here, and one of the most common question I hear from my diabetic patient is, Doctor, what should be my blood sugar be, right? Answer depends on your age, insulin, and medication. But today I'm going to explain the ideal blood sugar range for everybody, why the same number isn't safe for everyone. So for adults age 20 to 59, um, and for most non-pregnant adults with diabetes, the fasting blood sugar got to be somewhere between 80 to 130 milligram per deciliter. 2 hour post meal should be less than 180 milligram per deciliter, and A1C hemoglobin A1C goals should be below 7. Younger adults can aim for tighter control if there is no risk of hypoglycemia. For seniors, age 60 and above, as we age, the body becomes more sensitive to hypoglycemia, and so we have to make sure that the risk of hypoglycemia is averted. So for elder adults, we are more liberal. Fasting blood sugar could be between 90 to 150. Post meal could be less than 200, and hemoglobin A1C target can easily be somewhere from 7.5 to 8. The focus shifts from tight control to safety and stability. Now, for children and teens for type 1 diabetes, for kids and teens with type 1 diabetes, sugar control must allow for growth and play. So before meals, 90 to 130, bedtime, 100 to 180 milligram per deciliter, and hemoglobin A1C below 7.5. Parents should focus on balanced meals and frequent monitoring with the CGM, continuous glucose monitoring. For pregnant women, gestational diabetes, pregnancy needs tighter control. In fact, the tightest control to protect mother and baby. So fasting blood sugar should be less than 95. 1 hour after meal should be less than 140, and 2 hour after meal should be less than 120. Even every mild spikes can affect the baby growth, so frequent monitoring with continuous glucose monitoring device is the key. Conclusion: blood sugar goals aren't one size fits all. The range depends on your age, risk of hypoglycemia, and overall health. So you should always talk to your doctor, personalize your target. If you have other comorbidities, that has to be considered and taken into account before setting a target for your ideal hemoglobin A1C. This is just guidance, and I'm of course not a doctor. I am trying to give you information. You can empower yourself with the knowledge, and with that knowledge you can ask better questions from a doctor. Thank you for watching.